Well, it's time for us to take note on another relatively serious subject that requires as much attention from government and every other participant as possible, and that is combating hepatitis in Sub-Saharan Africa. The fight against hepatitis appears to have taken a backseat amidst the wake of COVID-19, not just in Uganda, but across the globe. But my next guest is leading this silent fight across Africa. Her name is Dr. Kuku Appiah, Director, Medical and Scientific Affairs, Abbot Rapid Diagnostics. Good morning to you, Dr. Kuku.
Good morning. How are you? And good morning to all the viewers.
Well, it's a pleasure to have you here with us. Now, we just want to understand. Tell us more about hepatitis, because before COVID-19, there was a whole governmental campaign to actually get people vaccinated against hepatitis, especially hepatitis B. But then COVID-19 came and that took a back seat. Where do we stand right now?
Yes, so we have noticed that over the past 2.5 years, a number of health programs that were in effect in African countries have taken a backseat due to the emergency and the pandemic with COVID. So hepatitis has always been a neglected disease, a hidden killer. And so we are, as Abbot, we are trying to put additional effort and focus onto this disease so that we can get the initiatives that were in place restarted and maybe reinvigorated, because hepatitis B and C in sub-Saharan Africa is a major cause of illness and death, but not a well-known cause of illness and death, and specifically because it is a disease that affects people over a longer period of time. And for the majority of the time that you're infected with hepatitis, you might not have any signs or symptoms that would be easily noticeable by yourself or even by any healthcare professional, unlike other diseases. And so that is one of the reasons why it has really taken a backseat. But we would like to see more focus and more energy being put into the fight against hepatitis in sub-Saharan Africa.
Okay, all right. Dr. Kuku, I know recently there was an Abbot Media Roundtable, and following its conclusion, what is the prevalence of hepatitis B and C in the sub-Saharan region?
Yes, so it would appear that Africa in general, or what the WHO what we would call sub-Saharan Africa, accounts for 68% of people living with hepatitis B globally, and 73% of people that are co-infected with HIV and hepatitis B are living in sub-Saharan Africa. So with hepatitis B, it's 6.1%, or about 200 million people in Africa are living with hepatitis B. And if we go to Uganda specifically, we know that the prevalence of, whilst the data in Uganda is not very easy to come about, the recent survey showed that 4.1% of Ugandans are living with hepatitis B, but the prevalence for hepatitis C is not known.
Okay. How informed are people in Africa and also here in Uganda of the signs and the symptoms of hepatitis, and what role has Abbot played towards actually creating awareness of this disease within the region?
So people are generally not very much aware of what the signs and symptoms of hepatitis are, bearing in mind also that hepatitis only brings up signs and symptoms very late, like decades after a person was infected with hepatitis. For example, with hepatitis B, people are generally infected when they're still in their mother's womb or during the first 5 years of life, and then there are no symptoms or signs at that stage. So it's only through a regular testing and screening of people that you would know whether a person is infected with hepatitis. So yes, people are generally not aware of it. It's not a topic that is much spoken about, and also because we are really in Africa somewhat focused on the donor-funded illnesses. So HIV and to some extent malaria, and obviously COVID, which was the highlight for the past 2.5 years. These are the ones that people would be where there would be a more public awareness programs for people to know about it. But with hepatitis, not much has been done, and that is why Abbot decided to call together health writers, media experts, just to bring back on the basics of what the viral hepatitis is and what the initiatives are, what the targets are that have been set for elimination of these illnesses within Africa.
Okay, all right. Dr. Kuku, now the campaigns have been there, but there's barely been any information on how it's actually spread and the particular signs and symptoms. Neither have you actually given us those particular signs and symptoms. So could you give us, how is it exactly spread? What are some of the avenues through which people get to contract it? And then what are those signs and symptoms, or during what period should people start being aware and going for testings and screenings, as you've spoken of?
Yes, so the two main types of viral hepatitis that cause illness in Africa are hepatitis B and hepatitis C. And then with hepatitis B, people tend to get infected very early in life, but maybe within the first 5 years. It tends to be spread among children and through mainly oral and also blood-based. It's also spread from mother to child. And then hepatitis C is there are fewer cases of hepatitis C. It's more blood-based, so it affects people who use intravenous drugs, people that have tattoos or anything that would involve the exchange of blood, and also people and unsafe hospital practices, which is not very common in Africa, but in some regions there are situations where needles are shared in the healthcare centers. So also people that have tattoos that are unsafe or share razors or any other traditional scarification. You know, in many cultures, when you see a traditional healer, they might use a small razor blade to cut you for some traditional scarification. If those are not sterile, those are some of the ways in which hepatitis C can be transmitted. In terms of the signs and symptoms, in the early phases, you would not have any signs and symptoms, but as the disease progresses, then you start to have signs and symptoms that relate to the liver, because it mainly affects the liver and it destroys the liver. It causes the liver to have fibrosis, to not function properly, and ultimately it causes cancer of the liver. So at that stage, a person would, have a very enlarged abdomen and jaundice, and not be quite sick. But that is at the very late stages of the disease. So the focus cannot be on signs and symptoms. The focus must be on people having regular screening to know whether they have hepatitis B and C, and also, more importantly, to have the vaccination against hepatitis B.
Okay, all right. Dr. Kuku, you've shared with us the statistics within the Sub-Saharan region. You've also given us the statistics here in Uganda, 4.1% of Ugandans with hepatitis. Now, you have mentioned of some of the avenues through which we get to have people contracting this disease. Some of these avenues you've mentioned are entirely based on traditions and rituals of the community members of the Sub-Saharan region. So with your capacity, how do you expect to put up preventative measures that can curb this disease within the Sub-Saharan region in the presence of continued participation in these customs and cultures?
Okay, so if we take hepatitis C specifically, the modern innovation is that it is curable. So there is treatment that can be taken quite easily, and over a short course of treatment, the disease is completely curable. And so that makes it more important for people to be screened for hepatitis C, because there is treatment available, and also then for governments to make sure that the treatment is accessible to people throughout the country, and not just people who access the higher levels of health services. With hepatitis B, there is a vaccination that should be given at birth. And so when we look at from countries where the vaccination is mandated at birth, and then a 3-dose for children, you find that the levels of hepatitis B decrease quite dramatically in that country. But then we obviously have people that were born prior to the mandatory introduction of birth dose, and also if a child is not born in a health system where that birth dose is provided, that also would lead them not to receiving it. And it is quite time sensitive, so that the dose needs to be given at birth. Any delay in that has a less effect of the vaccination. But we are encouraging countries to really make that birth dose of the hepatitis very much mandatory throughout the health system. It is also important to test. So if every pregnant woman should be tested for HIV and for hepatitis and for syphilis. And this is what countries have committed to, because these are easily manageable if the mother is diagnosed in pregnancy, and also it prevents the diseases being transmitted to the child. So there is a lot that can be done, but the provision of safe practices both in the community and in the health center, screening of blood for these viruses, and the use of the available vaccine and the treatment, which is a cure for Hep C, are some of the tools that we can use to reduce the scourge of hepatitis in Africa.
Okay. Doctor, you mentioned test 3 times, meaning that screening is very important in the fight against hepatitis. What are the repercussions of late screening?
You see, you will not be, because it's a silent killer, you will not be able to know as a health system or as a government unless you do frequent testing. That is when you'll be able to allocate resources appropriately to specific areas and specific communities who need additional assistance. For example, as we said, for Uganda, the data for hepatitis C is still not known. So that's a gap, because then that means that the resources are not necessarily well allocated. But there are surveys that are ongoing and being able to fill in the gaps to make sure that people are tested. And then there's a group of people that would be entitled to have a vaccination. So everybody who is very much in the health system, including all health workers, all health students, police, prison, people that are in the prison setting, there are a list of people that need to be screened and also vaccinated as part of their occupational requirements for hepatitis B. So it's incumbent on the government to make sure that everybody who's entering the health system, every student in the health system, from laboratory, nurses, cleaners, everybody should be vaccinated, screened and vaccinated against hepatitis B.
Okay, Dr. Kuku, under the studies and the research that you have done with Abbot Rapid Diagnostics, what would you say have been the socio-economic impact of this disease on the region? Has it actually impacted the economic development?
Absolutely. It is absolutely impacting, because, if, for example, a person who has got what we call hepatocellular carcinoma, which is the end stage, like that's now cancer in your liver, as a result of chronic viral hepatitis, that person is going to consume an inordinate amount of health resources, hospitalization, expensive treatments, and ultimately not very good response to treatment. The same with the cirrhosis and the damage to the liver. All those are diseases that need to be managed mainly in the hospital and use up a lot of resources. So definitely there is a huge impact on productivity, on the economy of the country, if you have a very high rate of or uncontrolled rate of hepatitis in the country. It's a huge burden, but especially knowing that for hepatitis C, there is treatment, a cure that is available, and then for hepatitis B, there's vaccine. These can be gained at a more equitable price and in a preventative public health space, so that we don't end up with a large number of people developing end-stage viral hepatitis, which is the cirrhosis and the cancer.
Okay, all right.
Leading to death. Yes.
Dr. Kuku, right from Johannesburg, South Africa, talking about combating hepatitis sub-Saharan Africa. Now, we want to also find out, in this fight against the disease, what are some of the strategies, doctor, that are being used to eliminate hepatitis, say by perhaps 2030?
Yes, so it's always good for any public health challenge to have a well achievable target, and then looking at national strategic plans and frameworks. This is the building block. Once a country has committed to eliminating this disease, and then starts developing strategic plans, appointing people, and holding people responsible for certain targets. So for the 2030 target to eliminate hepatitis from the WHO and from the global community, that is looking at taking 2015 data as a baseline, looking at by 2030 having a 90% reduction in new cases of hepatitis B and C, and also both hepatitis B and C by 2030. So this is a target that Uganda and other countries have signed onto, and the way that we would see this being achieved is by mass screening, by availability of tests, and by treating people who are infected with these diseases, and making sure that there is a linkage between those people who are identified as hepatitis positive, making sure that they go through the whole cascade, are linked up to a health system, and then they get the treatment or the vaccination, and then they actually are recorded as being cured of hepatitis C or being vaccinated against hepatitis B.
All right. Finally, Dr. Kuku, how can the private sector support and join the government in the fight against the hepatitis, both in preventative, creating awareness, and also curbing the current statistics?
Yes, so the COVID pandemic has shown us that the private sector has a huge role to play within these public health initiatives, and a willing public-private partnership is a very powerful tool. So even with hepatitis, the private sector can play a huge role in awareness, in screening of employees, and in large companies, screening of the population that is associated with their industry, the people that they're doing business with. You know, the screening is just a finger prick test. It's something that can be done in 20 minutes, and private sector can definitely set targets to make sure that all their employees and customers have been screened at one stage or the other for hepatitis B and hepatitis C, partnering with government to provide the logistics that would allow the screening and testing to be and treatment to be provided. And again, when you have private sector that is directly involved in the supply chain of hepatitis B treatments and tests, trying to get the services provided at a very equitable way and at the best price that would support the government in the initiatives that they have set out. So it is really working in partnership with the government and the existing health system to make sure that there is much more awareness around, much more awareness and availability of services around viral hepatitis in Africa.
All right. Thank you so much, Dr. Kuku Appiah, for talking to us this morning about hepatitis B, combating it in the Sub-Saharan African. And her recommendation, both to the private sector and the government, is that they should increase screening in the population to be able to detect, create the statistic database that is needed to fight against this disease with the innovations and creation that science is coming